which is on the right. That's the tricuspid valve. And then the other one is the bicuspid valve. Okay, bicuspid valve on the left. So another name for the bicuspid, it is the mitral valve. Okay. Tricuspid, because it's got three flaps we're going to see. Bicuspid is got two flaps. Okay, you just have to memorize them. Again, the right side is the tricuspid, left side is the bicuspid or mitral. Now, don't forget, this is the anatomical position of the patient. So the patient is opposite from you. Okay, so you have to be careful not to get the right side and the left side confused. And between the ventricle and the arteries, there are two semilunar valves. So they look like semilunar, means half moon. Okay, here's a half moon. So the ventricle, when it squeezes, it has to go through these. Okay, so it squeezes through there, out. Now the reason they look like that, it's so that when it's done squeezing, it doesn't come back. When it comes back, the valve will stop it from coming back in here. Right? Makes sense? Well, when you squeeze, it pushes it right through. Okay, and when the ventricle relaxes, the blood will come back, but it will stop. The semilunar valve will stop it. Okay. So inside, when we cut him open, okay, so the atrium receives blood from three vessels. Is blood rich or poor in oxygen? So, of course, it depends on which atrium. All right. There is pectinate muscle, if you look at it. Okay. Prominent ridges, when it contracts, blood moves through the tricuspid valve into the ventricle. So we're now looking at the right side. Okay. These have to remember them. They are in the test. Okay. Chordae tendineae. Okay. They look like that. Okay. These striated thing looks like, okay, they sticking out, they call it papillary muscle. And these are called trabecular carinae. Okay. The tricuspid, which is the valve, has string extension called the chordae dentae, which then attach to the papillary muscle. Okay. Oh, here's those. Okay, chordae tendineae, and then is attached to the papillary muscle here. Here's another side that you can see the papillary muscle, and inside here you can see the trabecular pattern or the carinae. Okay, so that's what you're looking at. Okay, that's what you're looking at when they cut it open. Left side, blood from the right goes to the lungs. Okay, which four vessels? Okay, here are the vessels. Okay, the pulmonary trunk. Okay, and then out to the, are these arteries or veins? These blue ones are arteries. Okay. When the atrium contracts, blood moves through the bicuspid. Okay. So, here's the left side. That was the right side. The left side will come back from the pulmonary vein. Okay, so these are oxygenated blood. When it squeezes, it pushes through the bicuspid valve. Okay. Also called the mitral valve. And it's got the same thing. Okay. It's got chordae tendineae, papillary muscle. It's got trabecular carinae. Okay. Again, this is much bigger, and then it pushes through. Another semilunar valve. So the semilunar valve in the blue side is called a pulmonary valve. and the one in the red side is called the aortic valve. Okay, so easy way to remember, this goes to the lung, so it's the pulmonary part. This goes to the big aortic arch. Okay, so it's called the aortic valve. Okay, and the tricuspid and the bicuspid, you just have to figure a way to memorize it. Okay, so here's that big aorta. It goes, pushes through the aortic valve, and out here, and here goes up the brain, and then here goes down to the another part called the descending aorta, and down to your legs and abdomen and all that. Okay, again, here is looking at the cross section of the heart. Okay, you can see this is got 3 little flaps, so this would be a tricuspid flap. Okay, and this is bicuspid because it's got 2. Here are the semilunar valve. So these are like a cup. Okay, these are like a cup. Okay, when blood try to come back, it will cup it. Okay, the blue side again is the pulmonary, and the red side is the aortic. The 2 semilunar valve prevent backflow into the ventricle when the ventricle relaxes. So here's where the rhythm of the heart comes. Okay, opening and close based on whether the heart is relaxed and contract. So looking at this view, okay, right now the atrium is contracting, pushing the blood down to the ventricle. Once the blood is filled in the ventricle and the ventricle starts squeezing, okay, these guys will close because blood, it will prevent it from going up. Okay, and then it will squeeze through the semilunar valve and to the rest of the body and the lungs. Okay, it makes sense. Here it is. Once it squeezes, blood goes down. And when this squeeze, it will close these guys up. It will close it, and then it will open this way. Okay, makes sense? So this squeezes, the blood will squeeze and squeeze down here. Once it starts squeezing, okay, the blood will actually push these valves closed. It will close them, but then blood will have nowhere to go, but the easiest way would be the semilunar valve. Okay, same thing on the other side. Cardiac fibroskeleton. The opening and valves weakens the heart structure, so elastin and collagen is thicker around the heart. Okay, so that's what is called a cardiac fibroskeleton. It reinforces, so this is where that heart is cut like that, when we saw earlier. The coronary circulation, again, coronary vessels are those separate vessels that feeds the heart. Okay, technically it's part of the systemic. Heart is a large muscle, very metabolically active, needs its own blood supply and nutrient. The arteries on the left side, left coronary artery, there's a circumflex and anterior interventricular. We're going to see it in the another one. Well, anyway, I'll explain it to you here. Okay, so the coronary arteries are here. Okay, this is the interventricular, which means in between the ventricle. Okay, the right one is called the right coronary marginal and posterior interventricular artery. Okay, and so here is the again, coronary artery. Okay, the left one, coronary artery, and then this is the interseptum, and the circumflex actually comes off the left coronary artery. Okay, and the marginal artery comes from the right coronary artery. Well, actually, in this view, anatomically, this will be the right side because it is right by the superior vena cava. So this would be the right coronary artery going around to the other side, the left coronary artery connecting to the circumflex. I think we've seen this. This is how the muscle contracts. Now the heart muscle, again, is involuntary. It's got something called an intercalated disc. Right there, intercalated disc, where it is the electrical signal is transmitted through there. Okay, conducted through there. Again, it does not fatigue. So here is where we will learn about the conduction of the heart, like how the heartbeat goes, and then okay, how the electrical signal goes from here to here, because the heart doesn't really contract at the same time. It's just not one muscle that it's not one muscle that squeezes together like this. It squeezes at different rhythm. Okay, the first station start here at the SA node. Okay, SA node. SA node stands for sinoatrial node. Okay, sinoatrial.